So this is an older dog, so we're going to make the incision just behind the umbilicus. Basically, the closer you go to the umbilicus, the easier it is on the ovaries, but harder on getting the bifurcation. And the further we go down from the umbilicus, again, it's the opposite. Regards ovaries are harder, bifurcation is easier. But most dogs that have had a first season, I tend to go just behind the umbilicus. So I'll just make our incision, skin. And now we've trimmed the fat away, because what happens later on is when we're placing the clamp below the ovarian pedicle, the fat can bulge up and get in the way. So ideally just trim it away so we can see the linear elbow. A bit more thickness probably. You can see the muscle now. The linear elbow here is quite hard to determine. Yeah, nibble a bit this way just in case. So it looks like we've got a bit of a white line here. The muscles going off, yeah, so that looks like it's here. Not very clear though. Just see here. So use two forceps. It's very easy to miss the linear elbow. In dogs, cats are a lot more forgiving. So first one pulls it up, the second one just gets it nice and high. And then we'll just do a stab where we think it is. And come through. And we'll just check to see if we're on target or whether we're miles off. Yeah, we're on target. Just missed it very, by the side if you look closely. That's peritoneum, that's muscle. We've missed it like by 2 millimeters or something. So need to make sure. Go through this bit of peritoneum. Then we can extend. So I'll just extend cranially. Now extend caudally. Keep the muscle nice and high. Okay, so as soon as we go in, we can unfortunately tell she's pregnant. So she's a street dog, been caught off the street. So we're now going to extend the incision somewhat, probably another centimetre down. And see if we can exteriorize from there. Yeah. the ovary there. We've got some twist or something going on here with it. That's better. So fully exteriorize both sides of the uterus, because that will help the abdomen drop down a bit. So we've still got the same problem as in dogs. The ovaries are hard to get to, so we'll have to pinch down to get to the ovary. So we can rotate a bit more back that way. So I'll push the fat in there. And we're pushing down to get the ovary. Transfer the ovary to the right hand. And then you just come towards the end of the table. And we're sliding down the suspensory. Which in her case is hard to distinguish, which is suspensory and which goes to the kidney. There's two ligaments. Usually the one to the last rib, which we refer to as the suspensory, is the most prominent, but sometimes the kidney one can be equally prominent or more so. Right, so I can just go right down to the base and just touch it and it breaks. That's all you need to do with the suspensories, is get to the base and press it where it inserts. Just a gentle, usually, press, and it breaks that easily. If you're trying to twang it like a guitar string halfway down, it's just, you're there forever. But if you go right down to the insertion, to the last rib, you can usually always break them in about 1 or 2 seconds. Right, we're going to use the swab just to keep everything packed in. So we're not going to get caught in anything that stops it drying up. We want our window to the right, away from the vessels, and where it's clear and obviously no vasculature at all. So over here. If you don't do the window low, it means you can't put your Miller's ligaments in low under the pedicle. So we're going to use the carmalt clamp, which is basically like that, nice and smooth. So it means you can move the clamp around without causing damage. We've made our window, so we just place the clamp through the window, push down a bit and hold. And we check if anything's caught in our carmalt. If it hasn't, then just go a bit further down and hold. Nothing caught. We're about 1 inch away from the ovary, so we'll go with that. So we've clamped the carmalt there. Right, now to make life easier, we move the uterus to one side so we can see better. So important you go through the same window that we did the ovarian clamp. Put one just above the ovary, another clamp just above that, make sure they're fully wrapped down. And then just cut in between, and that takes the uterus out of the way so we can see the pedicle better, clearer. And you can see now that swab allows us to push the Miller's down without getting any fat caught in it. So form the Miller's, so we'll wrap it round the carmalt clamp or below. Any movement of the clamps you can rotate, that's fine, but don't start pulling them up because that could risk damaging the vessels. So that's our start position for the Miller's. Make the cross, hold the cross, go on round under again. Make an identical cross, again hold. Now you've got 2 strands here, 2 strands there, go in between, get the short tail, bring it through and back the way it was, which is that way. So now we drop the ligature, it's nice and loose. We don't want it forming close to the clamp because it won't get tight. So we're just dropping it. Usually once you get it past the body wall, it tends to stay past the body wall. On this side, we'll just nudge it that way. Okay, so now we're going to tie it off. So we'll put a clamp in here to keep rotation on the carmalt, and we need to go in as close as we can so we don't pull this ligature back up. Okay, so now we tighten. These must be super tight, so take your time. If they're cutting through the fat, that's great. It's a good sign you're getting them tight. Never hold back. Always 100%. Okay. Very occasionally you'll get a bit of umbilical fat caught in it, but that dislodges very easily when you let the ovary go. And you can see how it's again cutting through the fat because we're getting this sort of liquefied fat where it's going. Okay, so we'll cut the tails fairly short so they don't get in the way of the other millers. Never go pushing round here to check it. If you want to check it, you look at it on this side here. You want to see that pinched in figure 8 hourglass look. Now the beauty of separation of the uterus is we can test this first ligature. We're going to get some blood because it's been compressed, so expect that to happen. And swab it off, squeeze out as much as you can, and now release this clamp. And we can tell that ligation on its own is pretty much sufficient, but we put 2 for side of caution. So the clamp is now raised from where it was before. And now we just place another millers. Start position, make the cross around again. Make the second cross. Short end and back where it was, which is there. Okay, so this one we don't want it up against the clamp. Oh, there's sufficient. We'll do a bit of rotation, and then we've just got to get it to tighten in this position here. Want it off the clamp but not sliding into the other millers. So once it starts biting, it's not going to move. Okay, not very tighter, so I'll just do 6 ones. Okay. So now we're going to take the ovary off. Anytime I cut with the blade is now so I can go flush to the clamp. Now if you want to let go, hold in, that's fine, as long as you don't hold by the ligatures. You don't hold the ligatures and you've got enough tissue past the ligatures, so I would hold this here. So that swab out. Off she goes. Usually when you've broken the suspensories correctly, they just slip back in, so if you did need to grab it, it's easier to grab it again. So onto our other side. First Trick is suspensory. Ovaries tends to come up easier, so you need to hold the ovary, put a bit of traction on it so it makes the suspensory taut. These tend to be harder to break than the other side, they tend to be thicker, but you can sort of split it down into 3 with your finger. That's one split. Two. That's gone as 2. So you can see now how much more we can get this ovary out. So with the suspensory, you go right down to the base and then you tweak it there with the insertion. You've got to be right down there. The lower you are down, the safer it is and the easier it is to break it. So I'll just put a little pack in, keep this fat out of the way again. Make our window so it's nice and clear to the right. There actually. We just try and stay away from the vessels a bit more than we can. So now we want our carmalt, which is again here, remember it's there. And we've got our window, so we just go through, hold the carmalt, check nothing's in it, push it down a bit more probably, and we'll go there. Sometimes your kidney gets pulled up by the kidney ligament. Don't panic if it does, as long as your ligation's above it, which it will be, you'll be okay. So we've got now nearly 2 inches clearance, that's great. So first clamp goes above the ovary, second above that, fully ratcheted. That gets our uterus out of the way. Spleen decided to come up and say hello. So just replace that swab. So it's sort of like basically above the spleen. And now we'll get our millers ready. There we go. Finger and thumb, start position, make the cross, round. And second cross, grab the tail. So we'll keep it loose. This side's got the lumbar fat pad here. So if you start thinking you've got here some fat caught on the clamp, you haven't. It's the sublumbar fat pad which is attached to the pedicle. It's what we use in casts usually to find the uterus in flank incisions. So it's past the muscle layer, so it should stop there. Nudge that down there. Some rotation on the clamp. And again, we've got to work close in, otherwise we'll pull that knot up. Close and push down a bit here. Once it bites, it'll stay in that position. But tightening it, I get some vets coming to me because they can't do tight ligatures, and it's because they're tying out here. Just basically in close. That's that. You want your first 2 or 3 ones very good. Wow. Okay, so tail short for the first one. I'll check the ligature. Some blood will come out as we take this clamp off. So I'll just swab that up. and release our carmalts. We have a bit of a ooze on it, but we're doing 2 millers, so let's get the next millers on. It looks okay, but there was that bit of ooze, I think, so we need to check it again after this millers. So we want it off the clamp, but not sliding down into the other one. I lose count quite often. Okay, so we can leave a longer tail on this. Sometimes I'll check it this way first for any bleeding. That blood that was there stopped anyway, so that's good. So I'll replace the clamp, still clearing the ovary, and then we'll take it off with the blade. Okay, we already checked it, so I'm going to just release it. Again, it slowly goes in because we've done the suspensory correctly. So if it bleeds, they just go back up again. Makes life a lot easier doing suspensories. Right, so look at the broad ligament. Get some small clamps ready. Tend to ligate most broad ligaments because I'd rather have no blood than some blood. So vessel stays with the uterus, so window goes up this way. Extend it up so that when we're ligating the bit we do, it's not under tension. So double the clamp, so once it's clamped, that's that. Got a straight needle out. So nearly went through. Quite hard to thread it. It starts fraying. Try cutting it at an angle. Okay, so 2 pieces. Take the needle, use a straight needle so we can predict where it's going to come out. So it's going to lose some fluid because we're going through the uterus. Coming out about central there. So I'm going to check both our pieces are about equal length. Then we can cut the needle out. And what's good to do now is work out which bit goes with which. So we pull that one, this one moves, so this can go on this side. So that means the other piece will be going on the other side. Let me send it under there. So on to surgeons. As tight as we can get. So you can see how there's difference from a normal transfix, that it goes through one side then you loop round for the other side. With that, obviously the second side is never as good as the first side because it's using the loop round. And the first one after the surgeons is the one that tightens the surgeons. Okay. So you can see the blanching from the surgeons, blanching from the millers, and blanching from the transfixer. So we'll now clamp and cut. We'll leave some tissue behind. Always want a bit of decent amount of tissue. So I think we've got that there. Put that away for a second. So now we just check our pedicle. Always check it in that position because sometimes when it's that way, one of the vessels is trapped. And it won't bleed until you put it that way. Works fine, so we'll close her up. So ideally, load up your needle holders, 2 pairs of ratties to get the muscle where you want it, and then place ligation. If there's any sort of fat, umbilical fat or whatever, doesn't matter if you go through it with a cord, only matters if it sticks between the muscles, stopping the muscles heal together. These need to be snug, not super tight or anything. The reason I do simple interrupted is because years ago some students did continuous, which we used to do. 2 dogs opened up, so I promised them after that do simple interrupted. Just obviously if one knot goes on a simple continuous in a dog that's in a rescue pen, whenever we're looking after it, things go terribly wrong. And if ever you're using cheap Velcro, just make sure your last couple of throws are really tight, because quite often you'll see a knot unravel. They're called PGA, but we always refer to the first brand name it came out as. Most things like that. So now it's just fat and skin. Start the fat, deep superficial, superficial deep, so the knot stays under the fat. And then need to make sure our knots are covered by the fat, so just lift it up. So, first pass has to be deep superficial to keep that knot under the fat. Got a lot of dead space, what you can do sometimes is just take a nick of the muscle, like that, go through it. And that helps to sort of hold the fat down and reduce the dead space. We'll tie the knot about here. So to surgeons this one, you can use this just to get the right tension by tightening that or spreading the loop. get rid of our tail completely. This knot should just lie down if we go straight, I think, into dermals. Yeah, looks like that's what it's going to do. It's always like one step forward, 2 steps forward, 1 step back. So go back there. Did you go to where the last one came out? Here, go back there. On this side. Okay, I'll finish the incisions here. Rid of the tail completely. fix this needle. So the idea is wherever the needle glides through is where we go, because the knot's going to follow. Sometimes just probe it around. I won't push our luck on how far out the skin, because the needle's going to break soon. So, see there, goes over. And then a bit of traction on the suture material, but also push the skin away. And that's gone. Yep.